Do you do that? Or you just want to say, look, when the doctor,
This is
or
Miss Eva Johnson, and don't you touch that dial.
This is why I love having interns. Not having interns can be.
Hello, I'm Richard Quest of CNN.
Yeah, that is.
98.1. 98.1.
like, oh, so excuse me.
All right, Lagos, here we are. It is 17 minutes past 5 p.m. on this wonderful Thursday evening on Smooth 98.1. It's the Smooth Drive, and it's time to talk about your health and all the health topics that you need to know about your health, how to, make sure that you are in a healthy state of mind, your wellness is absolutely on point, and of course, tips and tricks, I beg your pardon, from seasoned medical professionals to help you to make the right choices and give you the necessary information that you need. Hey, you know what they say, information and knowledge is power. And like I said earlier, today we're going to be talking about the importance of breastfeeding. Yes, and once again, I have him in here with us. Last week, I had to talk about fibroids, the what you need to know, what fibroids are, what fibroids aren't, and all the myths were busted. And I was able to get him in once again this week. Joining me this evening is Dr. Adekunle Abiona. Very good evening, Dr. Adekunle. Welcome once again.
Good evening, Niall. Thanks for having me on.
Hey, it's always great to have a brilliant mind to talk about these issues, just simplify them because sometimes they seem so complex, they seem difficult to understand, but having someone who's able to explain what the issues are, break them down, it makes it a whole lot easier to understand and actually appreciate. And for all our listeners who would love to be a part of this conversation, you can send your messages in any questions you might have for Dr. Adekunle. Send your messages in via WhatsApp on 0809 440 981. We're also streaming live on YouTube. Yes, you can join the live stream on Smooth 981 FM Lagos. Join the live stream and yes, just be a part of what it is that we're talking about this evening. All right. So, like I said earlier, discussing or having a discussion on the importance of breastfeeding. So, Dr. Adekunle, let's get right into the heart of the matter. Can you explain the natural process of breastfeeding and why it is often recommended for new mothers?
Thank you. Um, the natural process of breastfeeding, I would say, is like when you put when a baby is allowed to to feed. I don't want to use the words I will now use again. Is allowed to feed
I get what you mean.
directly. Is made to feed directly from the mother
Okay.
using the baby's own natural reflexes, which are latching and sucking. These are natural reflexes that the baby they bring it from the uterus.
Okay. That comes naturally to all babies
Comes
by
naturally to all
default.
babies, except there's a problem.
Okay.
So when the baby is brought to the mother and brought close to the mother, the baby will naturally locate where the nipple is and latch on it and start to suck. In some other cases, you can help the baby get to it,
Mm.
but that latching and sucking is just a natural instinct.
Mm. Okay. Okay. Now that's actually very interesting. Knowing that that reflex is something that is inborn in all babies, like you said, unless there's a problem.
Yeah.
Now, how exactly has the perception of breastfeeding changed over time? Because I know that, or I've heard different things at different times over the years about, women talking about formulas, not breastfeeding the babies, different things. So over the years, how much has that perception changed?
Well, over the years, there are so many things that has changed. Really, there are so many things that have changed from the days of our mothers and our grandmothers who believed that it's breast milk and pap at some point.
Pap was very popular.
Yeah, up to the days of nowadays where we now believe that breast milk is the best milk, has to be only breast milk for 6 months at least. For
Okay.
the first 6 months, only breast milk.
Not even water.
Not even nothing, just breast milk
Huh.
for 6 months. We call it exclusive breastfeeding for the first 6 months, and then going on after 6 months, you can now introduce complementary feeding. Then, of course, there's been a lot of changes too in the notion that some women cannot breastfeed due to some underlying medical condition. Some cannot breastfeed due to cosmetic reasons.
You read my mind because I was actually thinking like,
Yeah.
okay, what if there was something like that?
Yeah, so that has also come to play where we've had some other types of formula
Okay.
that try to imitate the content of breast milk.
Okay, now let me just touch on what you said about, you know, maybe some mothers for different reasons not being able to breastfeed that child. What then would happen? Is there anything that can be done to help the mother, or will she have to find an alternative to breast milk at that point in time?
Yeah, so there are different conditions. Let's start from the commonest one: cesarean section, surgery. When you had a surgery to have the baby. In some conditions, the woman might have to have a general anesthesia where
Okay.
she's put to sleep. Most conditions now, they don't put them to sleep. But in some conditions, the woman might have to be put to sleep, then baby brought out. Maybe in the first 12 hours or first 24 hours, the mother might not be able to be aware and well healthy enough to breastfeed.
Okay.
So at that point, there has to be an alternative, which you give formula just for that period of time. So when the mother now recovers fully, she starts to breastfeed ASAP. Other conditions, there are some women who just don't lactate. No, so yeah, they just don't produce any milk. That's another type of anomaly that we see, and it's quite common.
Okay.
In these cases too, they have to look for an alternative. Some of them don't produce enough. Some women don't produce
I've heard
enough
of that.
milk. So in that case, you have to supplement.
All right. Thank you for pointing that out. Now let's talk about health benefits here, because obviously for it to be generally accepted that a mother should breastfeed a child exclusively for 6 months, not even giving the child water. Obviously, there's something
Yes.
about breast milk which is healthy. So, what are those known health benefits of breastfeeding for both the mother and the child as well?
So let me come from an umbrella part where I take mother and child benefit first before I divide it.
All right.
So
all right.
for mother and child benefits, it promotes bonding. You're bonded with your child. I mean, you're able to say, "This is my child. I breastfed my child." There's this sense of pride and joy of motherhood that comes when you are able to properly breastfeed your child. That's on one hand. Then divided it into two. Let's take babies first. Babies who are exclusively breastfed are known to have a higher IQ than those who are not
Oh.
exclusively breastfed. Let's take it from there.
Okay.
Babies who are exclusively breastfed have more immunity, a higher level of immunity and protection against many illnesses, especially some allergic illnesses, asthma, and co. So they are better. You get. So on that hand, a baby who is exclusively breastfed is a healthier baby.
Right.
Through and through. On the mother's part now, if you breastfed exclusively, it reduces the chances of breast cancer and also reduces chances of ovarian cancer.
Interesting.
Yeah. Also, if you breastfeed exclusively, it allows the uterus go back to its pre-pregnancy state on time.
Okay.
Yeah. So those are like just a few of them.
Okay. Now, just on an aside here, you mentioned that breastfeeding promotes bonding between the mother and the child. Now, is
Yeah.
that something that could actually help where something like postpartum depression comes in? Is that something that could actually help with that?
Well, I've seen a few cases of postpartum depression. Not a few cases, actually, a lot of cases. And it's 50-50.
Oh wow,
Yeah. In some postpartum depression, we take baby away from them.
it's that serious.
Yes, it can be that serious because they have suicidal attempts to themselves and they want to harm the baby too. But in some, just a few words of counseling and making them see positive things about having a child can also help. Especially, I mean, but postpartum depression is another topic on its own.
That is
So
that.
if you
That
start,
is
you're going to be digging another.
that is a standalone.
Yeah,
That's a standalone conversation, which probably which we should actually look into having a discussion about
that's
that. But
fine. That's fine.
I'll put a pin in that one. Now let's come back to breastfeeding and the how beneficial it is in terms of the nutrients. Are there any particular nutrients that are in it that are especially beneficial for the baby in question?
I mean, there's all the nutrients baby needs. The nutrients baby needs for GIT improvement.
What is GIT?
GIT is gastrointestinal tract.
Okay.
We call
okay.
it gut improvement. Baby has it. The ones needed for the brain, it has it. The ones needed for the skin, it has it.
Okay.
So I mean, it's a one-stop shop for a baby from 0 to 6 months to have everything is in all the baby needs in terms of nutrients is in the breast milk for the first 6 months.
Wow, it's I just like the way you describe it as a one-stop shop.
Yes.
Everything is right there, which is why you begin to wonder why some women who are able to actually breastfeed, they don't have any issues about not producing enough or not producing at all, why they would not exclusively then breastfeed the child when the breast milk actually has everything
Yeah.
that is needed for that child at that point in time. It's something that you just begin to wonder. And well, maybe it could be due to some challenges, which is actually where I'm coming to.
Right.
Now, are there any common challenges that mothers face while breastfeeding, and is there even any support available for them?
Well, the common challenges, that mothers face while breastfeeding, it's not far-fetched actually. Just from normal thoughts of if you think of a woman who is breastfeeding,
Mm,
first thing she can suffer sore nipples
okay.
because there are some babies that can suck for Africa.
Very aggressive babies.
Yes, very aggressive. Sometimes they can suffer some level of breast engorgement, which can cause them some level of fever and rigor, as
Okay.
shakiness.
Mm,
It can also range from some, we call it mastitis. Mastitis is an inflammation of breast tissue where
okay.
the duct that carries the milk is plugged by congealed milk, and then it infects that
They can be
area.
congealed milk.
Yeah, so it affects that area, and then causes pain. Sometimes you have to do an abscess drainage for women that have it. Sometimes you can also have poor milk supply. Maybe in times when the woman is tired, maybe she's stressed out with maybe some other kind of work,
Mm,
then she doesn't produce milk on time. Then you have a cranky baby. They start
Okay.
battling back and forth. Yeah, so those are some of the natural challenges.
and when you talk about the poor milk supply, that could be caused by different by various
Yeah,
other things.
various factors that can induce stress for the woman.
All right, interesting. It's an interesting conversation we're having. We're talking about the importance of breastfeeding to the mothers and the babies as well. Once again, you can be part of the conversation by sending in any messages that you might have, any questions you might have for Dr. Adekunle Abiona here, and he'll do his best to answer these questions. The number is 0809 440 981. I have a question here, but I'll take a couple of questions actually, and I'll take that on the other side of this quick breather. Don't go anywhere. This is Smooth Health on Smooth 98.1.
Smooth Health on the Drive. This is Smooth Health on the Drive.
This thing
Discover Lipton's flavorful and balanced taste. With our unique expertise, we select fine quality tea leaves from selected tea gardens around the world. Experience Lipton Yellow Label's flavorful and balanced taste in every
I think
sip.
I'm in the frame as well.
Discover Lipton's flavorful and balanced taste.
It's only fair if I'm not in the frame.
This is Smooth Health on the Drive. This is Smooth Health on the Drive.
And we are back. This is Smooth Health on the Drive on Smooth 98.1, where we talk about health and health issues. Today, we're talking about breastfeeding and its importance. And with me having this conversation is Dr. Adekunle Abiona. And it has been a very eye-opening one even for me, and I'm pretty sure it has been for our listeners out there as well. Let me go to WhatsApp before we continue the conversation and take a couple of messages. Okay, so there's a message here from Jane, and she says, "What happens in the case of mothers who have had a cesarean section with regards to the uterus retracting?
Yeah.
And also, what about mothers that store breast milk in bottles?"
So, if you breastfeed exclusively, even with a cesarean section, it will improve the chances of you getting back your uterus to pre-pregnancy state, whether CS or spontaneous vaginal delivery. Then, for women who store breast milk, it is being pumped by a sucking reflex too, from the artificial pump they use.
Okay.
So that's also a sucking reflex, just that it's not from the baby. And trust me, sometimes it could be stronger than the baby's.
Okay.
So it's also okay.
All right. There's another message here, and this is from Charles Chidozie, and I can't believe I'm actually going to ask this question, but hey, it's all about getting answers.
Yeah.
And he says, "Please, I want to ask the doctor, does this bonding between mother and child and nutritional value also apply for the senior men who love to be breastfed? Please note, these men are also called baby by our women." Just asking for a friend.
Well, if you have to breastfeed, or if you have to be breastfed by your non-lactating wife, that accounts for some bonding too, if you agree with me.
Okay, it's okay, but that is on a psychological level.
Yeah.
Okay, there is.
I mean, even sucking, breastfeeding the baby too is a psychological. It's on a psychological level, because baby feels loved, and the mother feels like she's doing good to someone that came out of her.
Okay.
So if you are doing that with your partner, I mean, it's not bad, because it's also some level of bonding, and you have to have bonding before you get to that level of. You understand? Right?
Well, there's that.
Bonding continues.
All right, all right, Charles. I hope that answers your unusual question. Anyways, back to the matter the matter at hand. When we talk about, I asked earlier about the challenges that mothers face. Now, how can family, friends, even healthcare providers, how can they support a mother that is breastfeeding? What can they do to make her life easier and just help her along that journey?
First thing you need to know is that breastfeeding is not a joke. Breastfeeding is serious business, and you need support. So once the husband or the father of the baby, or the mother of the woman, or the mother of the man, whoever is coming for Omugo, because it is highly recommended for you to have a lot of support system while you are breastfeeding.
Okay.
Once they recognize that this woman is doing a full-time job, because it is a full-time job when you're breastfeeding a baby from 0 to 6 exclusively, so they have to help her in attending to her other needs. Sometimes women, after having breastfed so much, they tend to be a bit tired. Then the husband can just take the baby away for the night and
Okay.
assist for the night. Sometimes breastfeeding sitting positions can be a bit awkward and painful, so we tend to give them some level of you advise some breastfeeding pillows. But then, if you can't afford a breastfeeding pillow, after massage, it won't be bad for your husband to give you a back rub.
Mm.
Just a lot of support. Then, in the healthcare sector, one thing I have noted, or one thing that I have known in my years of experience is that breastfeeding mothers, they want to be listened to.
They want their thoughts and opinions to be
Yes,
heard.
yes, they want. So if you are a doctor or a nurse and you have a patient who's a breastfeeding mother, trust me, she's got something she wants to tell you that is different from what you've heard from somebody else. Because the breastfeeding journey is different for every woman.
But looking at what you just said
Yeah.
now, does it mean that some women who are breastfeeding, their voices are not heard, or the nurses or the healthcare practitioners do not listen to them? Does that happen?
So I mean, so in my years of practice, yes, I've seen cases where a doctor or a nurse can just stereotypically treat a nursing mother just the way he has treated the other nursing mother, especially when they come for immunization. They want to say something, they want to express some type of feeling. But because we see nursing mother every day, we see every day, and the same problem all of you
If
have.
we've seen one, we've seen all.
Exactly. So that kind of thing. So that's one thing. That's one way we can improve in the health sector. And also, when it's time to give medication for some condition, just about getting it right, and also a lot of advice and psychological support too from the health sector.
Very, very important that the support comes from all corners. Now
Yeah.
let's bring this to the workplace, because it's kind of hard not to talk about breastfeeding, not talk about mothers,
Yeah.
Working mothers who are breastfeeding, and the issues they might face, challenges they might face as well.
Yeah.
Now, how would it be possible, or how easy would it be for working mothers to manage breastfeeding? And are there any kind of accommodations or adjustments that you would suggest that employers could make to make life easier for
Yeah.
breastfeeding, women?
One of the major reason for maternity leave is so that the mother can breastfeed and bond properly. However, in our environment, after the maternity leave, a mother who is still willing to adhere to the 6 months exclusive breastfeeding can take two options. One, she can choose to express the breast milk, can express it and then store it up in the fridge, can stay for up to 4 days in the fridge. It could be frozen too.
Really, frozen
yeah,
in the freezer,
yeah, it can be frozen.
and it'll be fine.
Yeah, and when it's defrosted, you can give the baby within 24 hours.
Okay.
Or when you express before you go to work, should be given within 4 hours. That's an option of expressing your breast milk in bottles. Yeah, but also by law in Nigeria, a nursing mother is entitled to 30 minutes twice in her shift. 30 minutes twice, maybe in the morning, 30 minutes in the later in her shift, within 8 to 4, 30 minutes twice for breastfeeding by law. I'm sure a lot of people don't know.
Even I never was
Yeah.
never heard that before.
Yeah.
Interesting.
And also, I also advocate, because I've been to quite a number of offices where they have breastfeeding nursery areas.
Okay.
Yeah,
Okay.
for breastfeeding mothers and their infants and the caregivers. So when you want to breastfeed, you just take a break, go there, breastfeed, and then you come back to your seat. So if that can be replicated across, that would be very, very accommodating.
All right. Good stuff. Good stuff. Very interesting and very eye-opening, because once again, even I wasn't aware that that sort of guideline
Yeah.
was there. All right. Let me go back to WhatsApp and take this message once again from Jane, who says, "How can I tell if my baby is getting enough milk?"
Right. So naturally, when a child is full from breastfeeding, the child will stop latching, will stop sucking. Naturally, they'll stop sucking.
Okay.
Yeah. So that at that point, the baby is full.
That's the sign
Yeah.
to look out for.
Mhm.
Okay. Charles Chidozie once again sends in a message. He says, when it comes to the challenges and inconveniences of, you know what, Charles Chidozie, I will come back to this your message It's
Go
is
deep.
yeah, it's deep. It's deep. I will come back to I'll come back to that message. But let us stay focused on the conversation
Yeah.
at hand. Okay, now let's talk about we mentioned earlier we talked about formula, breastfeeding. We kind of like compared both. Is it uh, when it comes to breastfeeding, is there any alternative that you can say, okay, if you put breastfeeding on this level, that alternative you can also put it on that level, or
Yeah.
is there any, or are there any alternatives that are close? I mean, in a situation where for whatever reason, as we mentioned before, a mother cannot breastfeed, she would definitely want something
Yeah, to be given. Yeah,
which is
definitely.
close enough
Yeah, definitely.
to that.
So there are alternatives, but there was one advert on the TV back then. Serepa Shekini. If no be something, it no fit be like something.
Something.
Yes. So if it's not breast milk, it cannot be like breast milk. WHO still strongly recommends that breast milk is the standard. But then in other cases you cannot um, where you cannot breastfeed, then there are formulas that even cater to premature children.
Okay.
Yeah, so from prematurity up to maturity, and as baby grows, there are formulas that can work.
Mm. Okay, now let's still talk about these mothers or women who are not able to breastfeed. What advice do healthcare providers give to these mothers who cannot or even choose not to breastfeed?
So for women who cannot breastfeed, who want to breastfeed but are not able to produce milk, sometimes we give them some medications. Sometimes we ask them to take some cookies. There's some breastfeeding cookies. Sometimes we just ask them to take more fluid. And then when we flogged every available option, then with no avail, then we can now result to um, formula. Yeah. For those who choose not to, of course, I've seen a couple of women who's got some breast implants in place and have chosen not to breastfeed. That's okay. They take the formula option.
Mm,
But
or
note, nothing is better or more recommended than breast milk for babies from 0 to 6 months.
all right. Now, speaking about medication, when it comes to breastfeeding, feeding mothers, are there certain types of medication that they need to stay away from
Yeah,
that would affect the quality and the quantity of the breast milk?
yes, there are quite a number of them. Quite a number of them. Some sedatives, some antidepressants, quite a number of them. That when they take it, the baby it is secreted in the breast milk and can
Hmm.
affect the baby.
So okay, so does it mean that this is something that the doctors would need
Oh
to
yeah,
be very much aware
yeah.
of?
So the doctors, most doctors know that when you are breastfeeding, these classes of drugs are not meant to be given. So when you come to the clinic and we see that you're breastfeeding, some drugs are erased from our head already, and we go for other safer alternatives, or no drug at all, depending on the situation. Yeah.
Okay, let me just ask this to round up. Okay, before I do that, let me just take a message from WhatsApp. This is Kweju. Kweju says, "What about the option of milk banks?"
Yeah. So interestingly, I have seen a situation where a nursing sister, like two women, gave birth. One was incapacitated to breastfeed, the other one was breastfeeding. The sister actually took her sister's baby and breastfed both of them. So that's okay. You can breastfeed. That's okay for somebody who is a family who you trust. Somebody
Hmm.
who you trust can, yeah, that's okay. But breastfeeding banks, there was one woman on the internet that was able to produce at least like having 1,000 bottles of milk. Yeah, 1,000 liters
What?
of milk per year. Yeah, she kept lactating and it was so much she was giving it out. So breastfeeding banks, yeah, they are also very available
Oh wow.
for people. There are available options for people who cannot breastfeed or who choose not to breastfeed. Yeah, that's a good one.
All right. Cisco Delgado says, Ayo, my wife tried only breastfeeding alone for 6 months, but it was having a negative impact on our baby boy. He looked malnourished, but combining the baby milk with
Yeah.
breastfeeding, it worked.
So it means the baby wasn't getting enough quantity.
Ah.
Yeah, baby wasn't getting enough quantity of breast milk because, as I said, some people produce. So I've seen patients where when the baby is born, baby is like 3.7 kg. At 6 weeks, we expect baby to have added at least 1 kg. Then at about 10 weeks, the baby is weighing 3.5, 3.4. And I'm like, have you tried to breastfeed? I said, doctor, I breastfeed this baby so much. And I'm like, you know what? Get a pump. Pump for 30 minutes. Let's see. For 30 minutes, she produced just 30 mils. She was crying.
Wow.
Oh, she was crying. When she saw that she was the one that has been, in quote, punishing. I had to tell her, no, it's not your fault. You're not punishing this baby. You do not know. She's a new mother.
She doesn't realize.
You didn't know. Now that you know, let's add formula. And then we monitored the baby, and people did very, very well. So it's not all cases that the quantity of breast milk will be, I mentioned earlier, so it's one of the challenge.
Yes.
At that point, when you know that this baby is not growing well, that's why it's important to go for immunization checkups too, where they can weigh the baby and examine the baby. So at that point, they can look, there's a problem here. Let's take action.
All right, interesting. Henry from Lekki, in response to what you said about the lady who was producing lots of milk, said she's a Guinness World Record holder, apparently.
Right.
That I did not know.
Right. I saw it.
It's 1,599 liters.
Right.
Of breast milk. That is quite a lot.
And it was up to 1,000.
Thank you, Henry, for that bit of information. All right, Dr. Adekunle, in about 30 seconds or less, what would you have to say to new mothers who are breastfeeding or trying to breastfeed, having issues? What would you say to them? Just to make them more comfortable or more confident.
Well, whatever challenge you're having with breastfeeding, know that it is not your fault. And you're not alone. You're not the first person. So you can also always reach out to people who are more experienced. You can reach out to healthcare professionals. Let's not joke. Your support system, your mom or your grandma or your mother-in-law might not be the best person to support you in that situation. Where they have their own beliefs and value system that they impose on you while you're doing your breastfeeding job. So you can also reach out to healthcare professionals or other people, to get support. And then, don't close your mouth.
Be expressive.
Especially breastfeeding, don't close your mouth. There's always an answer.
Okay. Okay. Let me just squeeze in this message because I think this is something that people really need answers to. Hi there, Ayo, and good evening to the doctor. Please, I'd like to ask: are there biologically or genetic implications when one lactating woman breastfeeds another woman's baby? Is it medically hygienic? What about HIV, hepatitis, and so on and so forth?
Exactly. That's why I put out that clause. Someone you trust. The only scenario I've seen was two sisters.
Okay.
Yeah, she breastfed her sister's baby. I've seen that. But in this part of the world, it's not a thing. In fact, why are you breastfeeding my child?
So many other factors begin to come in.
Exactly. So I understand that person's point of view, but then somebody you trust.
That's the caveat.
And then if it's coming from a milk bank, of course, you're sure it has been screened. The person who produced it has been screened before it's been sold to you.
All right. I hope that answered the question, but hey, we really have to wrap this up. Thank you so much, Dr.
Thank you,
Adekunle Abiona, for joining me once again to have this eye-opening and very, very, very insightful conversation. It's always good talking to you.
Thank you very much.
All right, do have yourself a great evening, and thank you all to all our listeners out there for being a part of Smooth Health and sending in all the messages and questions. Hope your questions have been answered and you have a bit more clarity. Smooth Health will be back next Thursday at 5:15 p.m. Meanwhile, just stick around. Do not go anywhere because the Smooth Drive will continue. Don't go anywhere. Stay with us.
Else on the drive.
30 minutes is not enough.
You're not the first person to say
Let me
this.
just tell you, because there's still so many things.
You're not the first person to actually say this.
Because
So we went on the streets to ask people
there's
how
a
they
cultural
love
aspect
Breastfeeding.
of breastfeeding where some cultures in the world believe that colostrum, the